All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. Today we are going to talk about President Trump's management. And I have seen lots of YouTube videos and the news cycles and the articles about the management. Some people have certain concerns and so on. What I wanted to do was to go over the management together to look at various drugs that are used and their mechanisms of actions. So once again, this discussion is not going to be more political or more people trying to be doctors and telling what should be the right thing. Instead, let us see what he was given, and let us see that when he was given those drugs and how his recovery, I think, has been fast and decent, how that recovery was enabled by these drugs. Of course, his own immune system should be taking part in a major way to help protect against the virus. But let's see what are the drugs that are in there. My one takeaway from all of this is that if we take anybody and we treat them early and aggressively, we can actually make a difference, and rapidly. So with this, let's start. I'm going to share my screen. And please tell me in your comments, what do you think should have been the treatment or management? What are your thoughts? My interesting outcome for me was that all of the therapeutic agents that were used, we had discussed them before in thorough, in exhaustive way with proper mechanism of actions. And very interestingly, just a couple of days ago, now 3 or 4 days ago, we talked about Regeneron's antibody cocktail, and they had used that as well. So welcome to the show. Let's start our discussion. So the medicines or the drugs that are given, or the cocktail of overall various agents that are given, of course, there was a couple of times oxygen given. And please realize this, that I have not been in there. I've not seen things with my eyes or heard with my own ears. So this is all what we have been seeing or what has been reported. So there may be gaps in my knowledge, which again, doesn't matter. The doctors are doing their work. I just wanted to make sure that we explain the drugs that are used and what is their benefit. For the overall discussion, keep in mind the following things. We know that the disease COVID-19 has two primary phases. Number one is the viral phase, and the second one is immune dysregulation. Correct? And it's not necessary that the viral phase has to finish in the viral phase time, that is 8-10 days. There could be some amount of virus continuing, and the immune dysregulation is not necessary that it should only occur after 8 to 10 days. It is possible that it starts earlier as the immune system starts overreacting, if at all, and then it continues on later on. And of course, we also know that there is a possibility of a long hauler outcome where some immune dysregulation, some viral remnants may be present in the body for a little longer period of time. So what we would see in the drugs is that what are the drugs that are working at the viral phase or the virus itself, and what are the drugs that are working for immune dysregulation. And we'll make our comments in there as well. And I would welcome your comments as well. We've been doing these discussions for a long time. So starting, Regeneron's antibody cocktail. So this is the interesting one, and we had talked about it as well. Interestingly, media has been trying to figure out, should we call it monoclonal antibodies or should we call it polyclonal antibodies and so on. Basic mechanism or basic cocktail is that these are kind of monoclonal antibodies. That means these are antibodies that are produced against the spike protein, a specific area of the spike protein. So from that point of view, it is a monoclonal antibody. But there are more than one monoclonal antibodies. Because of that, they can be called polyclonal, but polyclonal normally means hundreds of types of antibodies. So the company took the route of calling them a cocktail instead of polyclonal. So these are really monoclonal antibodies, which are more than one types. And how do they work? So here is the coronavirus, SARS-CoV-2. And the company has created the antibodies that are going to attach to the spike protein. However, there are more than one type. So they would attach at various places of the spike protein. Imagine if my head for a second is the spike protein. So then maybe there is a antibody that is attached here, and then there is another antibody that is attached here. The benefit of doing that is that virus cannot easily mutate in all those places where the antibodies are attached. So the neutralizing capability of these antibodies is more than another monoclonal antibody. Plus, because there are multiple sites of attachment, virus will have to mutate away from all of those sites to survive these antibodies, and it cannot do that easily. So virus gets trapped more easily and gets stuck or gets reduced. So this is not an antiviral drug. Instead, this is a virus neutralizing drug. The virus may be sitting out there, but it cannot connect with ACE2 because there are antibodies attached to the spike proteins. So hopefully that is clear. So with this, we'll continue. So this one, not antiviral, but virus neutralizing. And again, what should be the phase in which this is given? This should be given in the viral phase. If the patient is in immune dysregulation phase, then this drug would have no effect. So again, aggressive early treatment, you are seeing the results of that. Then the next drug that is given is Remdesivir. And there has been lots of messages in the media. I find media is pretty strange in their way of depicting. Every single news is then cast as something really, the sky is falling. I'm sure that the doctors are there, they're looking at his situation, and then they are giving the correct medicines. I hope he has actually now been discharged. But Remdesivir, yes, Remdesivir does have side effects, which can be liver toxicity or renal toxicity or blood cell count disorders or respiratory system, respiratory organ function dysfunction as well. So it has pretty serious side effects. The function itself is antiviral. And again, I don't think Remdesivir has so far proven itself to be effective. But still, let's look at the mechanism of action. So what it does is that, let's say this is the virus RNA. The virus has entered a cell, and then inside the cell, the RNA is present. This virus RNA needs to be replicated by the viral enzyme called RdRp. Right? So this RdRp enzyme is important, that it would help replicate the virus. Remdesivir, when the RdRp is working, it is going to pick up the raw material. So it's going to make copies of the viral RNA, correct? So for that, it needs the raw material from inside the cell. So what are those raw material? There are many kind of nucleotide bases that are used. Remdesivir acts as a decoy. It acts as a fake raw material. It acts as a bad raw material, especially for the adenosine triphosphate. And so that is, imagine that is a brick in a house. So virus needs a lots of bricks to make its RNA. And one of the brick is actually a weak brick. When the virus will be formed with that brick, it will break apart. So Remdesivir acts as the adenosine triphosphate analog. And when the virus RdRp uses that RNA, that Remdesivir as an RNA piece, what happens is that the Remdesivir would stall or disrupt the function of RdRp. That is one. Secondly, Remdesivir is also supposed to disrupt an enzyme that virus brings with itself or is manufactured inside the cell, which is a viral enzyme, and that enzyme is an exonuclease. What is an exonuclease? Imagine if this pen here is the newly formed virus RNA. Then the exonuclease would go over this pen and it would do proofreading to try to figure out if all the RNA is correct. So this SARS-CoV-2 is a dangerous virus in this way, that it comes in with its own proofreader that would make sure that the stability of RNA is maintained. Remdesivir supposedly also disrupts that enzyme. So let's say this is the enzyme of the virus, and this enzyme's function, this is an exonuclease, its function is to proofread the newly built RNA and make sure that it is healthy and correct. Remdesivir would block that as well, disrupt that as well. So virus cannot make sure that the new viruses that are formed are good viruses, because one, they have bad raw material, and secondly, their proofreading is not correct. So the bad disabled viruses will be formed, which will not be able to work. So this is an antiviral drug. So again, what should be the time to give it? Early phase, when this is the viral phase. So when remdesivir is given in the hospitals at the later stage, much of that time, the later stage does not have any efficacy for or use for remdesivir, because remdesivir should be administered early at the viral phase. So hopefully that is clear. Then zinc. So I only have one comment on the prescription, and that is on the zinc. And that is, zinc is in the prescription, but I didn't see any zinc ionophores. And that was interesting. I do not know how they were looking at using the zinc, but eventually the function of the zinc is the following, or at least the theoretical function is the following, that zinc will have to enter the cell, and then it will go and also disrupt the RdRp enzyme, the same enzyme that the remdesivir is disrupting. But remdesivir disrupts that enzyme by faking as a raw material, bad raw material. So it doesn't do anything to the enzyme. It just behaves. When enzyme picks up a brick to use for RNA, remdesivir is there, and that is a fake brick. Here, zinc would actually directly damage the RdRp, and that is how it works as an antiviral. However, for the zinc to do this, it has to be able to enter the cell, and for that, we've been talking about it for a long time. Zinc is a charged particle. So charged particles cannot enter the cell very easily, or cannot enter at all. So for that, they need some sort of a channel, and those channels are hydroxychloroquine can act as that channel, EGCG from green tea can act as that channel, quercetin can act as that channel, and other ionophores can act as that channel. So in the prescription, I saw that there was no ionophore included. So maybe they were trying to make sure that the zinc's level are correct, but that was what it was. So that was a zinc RdRp disruptor. For that, it has to be inside the cell. And they didn't have the ionophore. That was the interesting part. Then is the vitamin D. And I have kept the vitamin D section here very brief, because we've talked about vitamin D at length in a lots of discussions, lots of videos. I'm actually quite happy that some of those videos have 500,000 views or near 500,000 views. So they're quite popular. So vitamin D in general helps keep the respiratory barriers and the cells healthy. Secondly, vitamin D, as we know, are immunomodulators. So this is the effect other than the calcium and magnesium and phosphate and bone behaviors. We are talking about antiviral type or effects used for pathogen resistance. So it is immune modulator as well. And a few days ago, we talked about a study in which they saw that people who are greater than 40 years of age, who are at a higher risk of the viral cytokine storm, when they had their vitamin D levels greater than 40 nanogram per milliliter, then the mortality rate was down to 1.6% compared to other who had lesser vitamin D levels, and the mortality rate in them was very high. I think it was 7% or higher. So this was a significant drop. So vitamin D is a very important thing for all of us to keep high. And so this is good that they administered vitamin D. I'm sure that with that, they were looking at the calcium levels and magnesium levels and phosphates, and making sure that all those extra supplements that need to be given were given. But vitamin D was given as well. I do not know what was the quantity. I do not know what were President Trump's vitamin D levels in the blood and how did they push them up. But vitamin D was part of the prescription, which is good. Then famotidine. So famotidine is actually a H2 receptor antagonist. It has been used for peptic ulcers and gastroesophageal reflux and Zollinger-Ellison syndrome. So some of the GIT-related diseases. However, some without knowing the exact mechanism, we know that famotidine, when given to COVID-19 patients, it reduces their mortality. That is just an observation. That is a study, but exactly how does it do it is not very clear. And similarly, I want to make a comment about remdesivir as well. Remdesivir may be not efficacious, but it is known to reduce the time to be in the hospital. So this is the famotidine. Then is melatonin. And we have talked about melatonin in the past as well. And all of these drugs, we have talked about them. I put their links out there in the description, with the description link out to Wikipedia, plus links to our YouTube videos as well. Now, melatonin is a natural substance that is produced in our body by our pineal glands. It is a safe substance. It gives us better sleep as well, that allows us to relax and have a better immune system and recover better. In addition to that, we know that melatonin is anti-inflammatory, antioxidant, antiviral as well. And how does that do it? Again, my video was a full video with that mechanism. I'm just going to review that mechanism very quickly over here. So what happens is we have pyruvate in the energy cycle, in the glycolysis cycle or glucose breakdown cycle. We eventually make pyruvate. Pyruvate goes into the mitochondria, and over there it is converted into ATP. In that process, it also becomes converted to serotonin or 5-hydroxytryptamine, and from serotonin, and from there melatonin as well. This melatonin that our cells produce in their own mitochondria, that melatonin acts as an antioxidant within the cell. Now what happens is, when our cells are infected, our cells start producing pro-inflammatory cytokines. Remember, we've been talking about it, that the cells would produce interleukin 1 and 8 and 6 and 12 and TNF and GM-CSF and so on. Many kinds of inflammatory proteins. So imagine that this is a cell that was infected and it has inflammatory proteins produced in it. These inflammatory proteins, what they do is they actually activate an enzyme called pyruvate dehydrogenase kinase. And what does that do? Sorry, let me just make it a little bigger. So imagine this is that enzyme, pyruvate dehydrogenase kinase. This enzyme will cause the blockade of another enzyme called pyruvate dehydrogenase. When pyruvate dehydrogenase is blocked, then this whole pathway of energy production is blocked. And if that pathway is blocked, number one, melatonin will not be produced. Number two, the pyruvate that was going in and getting converted will not be able to do that, and then we'll make more lactic acid outside. So what happens now is that when the cell is infected, somehow we now have more lactic acid produced, which is dangerous, but we also have less melatonin produced. If we give melatonin from outside, that is exogenous melatonin, then what happens is that melatonin would come into the cell. It will go in the cell and start doing certain functions. One of those is that it blocks the pyruvate dehydrogenase kinase's activity. So when it blocks that frees up the pyruvate dehydrogenase enzyme, and this internal cycle of production of melatonin and energy resumes. In conjunction with that, of course, the pyruvate towards lactate, that pathway slows down as well. So less acidity is produced, more melatonin is produced, more energy is produced. So overall effect is antioxidant and anti-inflammatory behavior. So that is the function of melatonin. For me, that was interesting because melatonin, maybe in the prophylaxis is fine, maybe the very early stages is fine. Otherwise, it is not as strong an anti-inflammatory to bank on it at this level. So melatonin was there. Then aspirin, and again, we have done lots of discussions about aspirin, but generally the function of aspirin is to keep the blood thin. So that should be for hypercoagulable state. So giving that drug was an attempt from the doctors that the hypercoagulable state does not occur. And again, there may be other reasons to have aspirin, but within the COVID's context for a healthy person, aspirin would help prevent the hypercoagulable state or reduce the chances of hypercoagulable state. So if you see here, what it does is, how does aspirin work? In short, so we know that there is arachidonic acid that is produced in our cells, especially those cells that are becoming damaged or that are infected. Arachidonic acid is converted into prostaglandins, thromboxane A2, and so on by the enzymes called COX-1 or COX-2, which are cyclooxygenases 1 and 2. Aspirin blocks these enzymes. So when these enzymes are blocked, then we will not have enough PGIT or prostacyclin and thromboxane A2. In here, thromboxane A2 is interesting because thromboxane A2 is produced inside the platelet. Platelet are responsible. So remember, thrombus is actually aggregation of platelets, and they make small, tiny, microscopic clots. And then these clots can merge together and become bigger clots as well. But the platelets are the ones that are to be blamed for that. And some they're blamed in case of COVID-19. Otherwise, this is actually a healthy function. So now when aspirin is present, aspirin is going to block the production of thromboxane A2 in a platelet. Platelet do not have nuclei. Platelet are produced from one big cell. So in the beginning, in the bone marrow, there is a big cell called megakaryocyte, and then platelets are like tiny teardrops that are separated from that cell. So platelets do not have their own nucleus. So if you damage their enzyme, they cannot produce more enzyme. So when aspirin goes into the platelets, it blocks the cyclooxygenases. Platelets cannot make more cyclooxygenases, so such platelets are disabled. They cannot aggregate, they cannot make thrombi. So that is the function of aspirin. So there is a question that, is vitamin K2 effective as an anticoagulant similar to heparin and aspirin? No, I don't think that vitamin K2 is that effective. Vitamin K2's basic benefit is that when it is given in conjunction with vitamin D, then the thrombotic function or the atherosclerotic function that would develop if K2 was not present there, that is reduced, because K2 would mobilize the proteins that would cause atherosclerosis. So K2 is more of a atherosclerosis preventer compared to the anticoagulation. So here now we have thromboxane A2, and that thromboxane A2 is not produced in the presence of aspirin. This platelet is now useless forever, and this would die and more platelets would be produced, and we would continue to give aspirin to keep disabling them, but that is the basic function for the aspirin. So again, in short, then is the dexamethasone. Dexamethasone, when they said that we are administering that kind of worried me a little bit, because to me it seemed like everything is given for all phases. Dexamethasone is normally given at the time. And remember, in Math Plus, they say that methylprednisolone is a better drug because it penetrates the lungs better, becomes available in the lungs better than dexamethasone. But anyways, there is a study from Oxford that shows dexamethasone is to be very, very good. The basic mechanism here is, this is for immune dysregulation. And what happens is, in here, we have two kind of mechanisms that are important to keep in mind. One is immune system misbehaving and becoming run away and dysregulated. And second is the inflammatory system, that is arachidonic acid pathway, that becoming overactive as well and causing thrombi and clots and those kind of things. So what happens is, let's look at very quickly how dexamethasone works for the immune system. It actually modulates the whole immune system. They are the super big guns to suppress the immune system. So the other drugs that modulate parts of the immune system, but steroids would step on the whole immune system and suppress it. So the innate arm is suppressed by them. Innate arm's production of cytokines and chemokines are suppressed with them. T helper 2 cells are suppressed. T helper 1 cells are suppressed. Beta cells function, or the humoral cells function, is suppressed, and cytotoxic T cell function is suppressed. This is why it is interesting that if it is given earlier, steroids, then it is possible that because the immune system is not able to fight anymore, the virus can just continue to replicate. Having said that, I would share with you that many of my friends start giving steroids in the very early phase, and I am always scared of it, that if I give steroids in the early phase, that might cause the immune system to become suppressed, and the virus would have free reign to do whatever it wants and keep replicating and keep causing damage. But people use it and they say that it is successful. Here, the ideal state will be that dexamethasone should be given when the immune dysregulation starts occurring. Now, for me, the indications will be when the oxygen levels are dropping too fast and too low, when the CRP, ferritin, and other pro-inflammatory proteins are increasing very fast, or when the immune dysregulation markers are appearing quickly, then you go ahead and you start using dexamethasone. So maybe the doctors felt that there were some oxygen levels dropping and they thought that let's just attack the situation as soon as possible. My concern was that maybe that can end up causing more viral load, but they were giving antivirals as well. So hopefully antivirals were kind of keeping the virus in check, and then dexamethasone type things were keeping the immune system in check. And then finally, another function of the steroids is the suppression of inflammatory system. So that is once again arachidonic acid pathway suppression, which would then cause reduction in thrombosis or hypercoagulable state. That would also cause reduction in inflammation in the lungs and in other places. So how does that work? So remember, we've talked about it, that the cell membrane has phospholipids. Those phospholipids are converted into arachidonic acid by an enzyme called phospholipase A2. So cell membrane phospholipase A2 would work on them and convert them into arachidonic acid. Arachidonic acid would then be acted on by cyclooxygenase 1 and 2 to produce PGI2 or prostacyclines, thromboxane A2, and other substances. Or lipoxygenase enzyme would work on arachidonic acid and produce leukotrienes. Many of these are pro-inflammatory, some of these are anti-inflammatory. Now what happens is steroids can block this whole mechanism as well. So we have two primary mechanisms, immune system and inflammation system. Steroids would block them both together. So what happens is when steroids are given, they would activate an enzyme called lipocortin. Lipocortin in turn blocks the phospholipase A2. When that enzyme is blocked, then no more arachidonic acid is formed. That means no more of these substances are formed, and so inflammation would go down. That is one. Secondly, lipocortin can also selectively inhibit cyclooxygenase 1 as well, and that is just an extra compounding effect. So this is the basic discussion of the drugs that are given and what phase they should be given. To me, it seems like steroids giving, again, doctors must know, they must have been looking at the labs and oxygen levels and blood pressure and other such ferritins and D-dimers and CRPs, and they were making decisions based on that. But to me, dexamethasone seemed that they were thinking there may be immune dysregulation. So this is the basic discussion for today. I hope that you are doing good. Welcome back from a weekend. I'll just take a couple of comments and see if I can answer them, and then we will stop and we will meet each other tomorrow. If you are looking to support my work, there is a link in the description to send in donations. And thank you very much for that. And also please like, subscribe, and share. So I'm just going to see some comments here. What do you think? What did you think about the management approach? So this comment that a lot of experts say he ain't out of the woods yet. So I heard the press conference by his doctor as well, and he said that he's something to this effect that he's being discharged and he's going to go back, but he's not out of the woods yet. I think he just used a rhetorical phrase, not out of the woods, meaning he's not fully recovered, and that makes sense. Everybody is going to take some time to recover. So Carolyn says that even though Trump is doing better, I worry that he'll crash like so many others have. So that is the uncertain part of this virus. But what I have seen is that most of the time when patients start recovering, it is difficult for them then to go towards the crashing side. Most of the patients who are going to progress towards more intense COVID-19, they usually keep fluctuating between the symptoms. They never look like consistently recovering. So Jim says that logic, so probably a discussion with logic, no one has died because of an extended QT interval. I can tell you from my own experience that in one case of hydroxychloroquine administration to one family, there were 5 members, they all developed fluctuation in blood pressure and heart rate. One case out of, I think, 200-300 patients that I've seen. So hydroxychloroquine does have that effect. This is also a surprise for me that they decided not to use things like ivermectin or hydroxychloroquine or ionophores with the zinc. So that tells me that his doctors did not feel that these were the drugs that could be useful. So they came out with the big guns right in the beginning. I think Remdesivir was kind of, maybe they were trying to cut down the time for hospitalization. They took a risk with with some damage that can occur with Remdesivir, but the cocktail was good. Zinc was good. Without quercetin was not good. Vitamin D was good. And then HCQ and ivermectin was absent. Dexamethasone, interesting that they felt that there was a need. So there is a comment by John Snyder. I'm not worried about the steroid. They are not being honest when he was first positive. Yeah, so again, I have not been there. I didn't see things with my own eyes or heard them with my own ears from the patient, but I'm sure that they are aware of what they're doing. Cool. So that is my opinion at the end of it. If everybody gets the attention the same way, that right in the beginning, aggressive treatment, maybe Remdesivir, no, but the other treatments, aggressive treatment in the beginning, as soon as somebody has the symptoms, bring them in the hospital or keep them at home and give them these drugs, I think we can save a lot of lives. So when we ask people to go wait, take Tylenol, and while they keep becoming intense, and finally when they reach the immune dysregulation, then we say, all right, your shortness of breath is there, come on in the hospital. I think then it becomes too late. So everybody should be treated in that aggressive manner. Correct, statins too. Cool. So thank you very much for today. Please like, subscribe, and share, and I would see you tomorrow. Please tell me your comments. How did you think the therapy was, and what did you think was missing or should have been not there? Thank you. Bye-bye.